The way I like to work with the scapula is by having the heel of this hand on the axillary border of the scapula, and on the other side, my other hand on the superior border of the scapula, my fingers around the middle border, and that way I have the scapula surrounded and I can move the scapula over the rib cage. The shoulder girdle is a gliding joint where the clavicle articulates with the scapula, usually moving as a unit. I also like to drape the client's arm over my forearm. That way I can move their whole shoulder girdle like this. We have two muscles in between the scapula and ribs, subscapularis and serratus anterior. And this way I can work both of those muscles by squeezing them between the scapula and ribs. When I do this, I have the client's arm behind their head. This helps to press the scapula into the rib cage. Also, moving the humerus and scapula as one unit is really important. We can go both directions because sometimes you will feel restrictions and movements going in one direction, but not feel it in the other direction. This position is also great for working into the rhomboids. What I like to do is put my fingers right by the spine and then come down and out to the scapula, pulling the scapula away from the spine, working everything that goes between the spine and scapula, and at the same time getting a little stretch on rhomboids while working into that. Another technique that I like to do from this position is to stretch the serratus anterior, and I do this by putting the heel of my hand on the rib cage and pushing the scapula back into the spine. Serratus pulls the scapula away, so it gets stretched when you bring the scapula towards the back like this. Serratus also twists the scapula, so I can press and twist the scapula downward, and most people need a stretch like this. This way it feels the best going this direction, bringing the scapula into downward rotation. From this position we can also work into the axillary border of the scapula. We have the three muscles that attach along here. You have the triceps, teres minor and teres major. The way I like to work in here is with the heel of my hand sliding down that border of the scapula while bringing the client's arm up and over the head. This will give a nice stretch on these teres muscles. You can also work with your forearm, gliding very slowly. From this position, you can also work on the client's latissimus dorsi by bringing their arm up and over the head, getting a nice stretch while working down over the back, following the edge of latissimus dorsi.